morning, everybody. We're waiting on Mayor Gibson. He may have had something else. He was supposed to be here, but you never know. With city business, sometimes things happen. He gets called away, or there's some fire going on, and he's having to deal with this. We're gonna go ahead and get started, and if he makes it in, I'll turn it over to him when he gets here. So Sherry, will you do a roll call for us?
Sam Gibson, Charlene Whitaker, Keisha Richards, Cindy Putman.
Here.
Zach Gilpin, Bill Fox.
Here.
Christy Payton.
Here.
Bill Gibson, Ann Stamps, Tracy Long.
Here.
Alex Conahan, Michael Burton.
Here.
Misty Fife.
Here.
Barbara Weaver.
Here.
Bob DeVries, Linda Pastrick.
Here.
Marilyn Davis, Patty Young.
Here.
You've got a copy of the minutes there. If anybody has a correction to that, I'd entertain a motion to approve those.
Make a motion.
Okay, we have a motion. Do we have a second?
Second.
A second. Any discussion? All in favor, say aye.
Aye.
Okay. All right, we'll move into our CSBG, update.
Alright, good morning, everyone. The first thing you'll see, it's time to sign those conflict of interest forms. So laying by your folder, is conflict of interest. If you don't mind to read that, complete that, you can just leave it laying on the table when you leave. This is something that's required by the Community Services Block Grant. We do this on an annual basis. We try to do this every June meeting, just so that it keeps it, we're on track, to get that done. So we've also put some dashboards in your binder. We keep those for you so that you can refer back to them. If you'll kind of look at that March and April dashboard, you'll see that we started our eviction rental program. We've been able to serve folks in March and April and continuing to serve those through the end of July. Is that correct? Through the end of July with that program. So this is really focusing on folks who are past due on their rent so that they are not gonna get evicted. I do have some good news to share. We are gonna receive extra funds for LIHEAP, and we should be able to clear our waiting list and also have funds going forward for the rest of the program year. Now, we don't know will we be able to serve everyone. We would hope so going forward, but we're very, very, very excited that for everyone who has applied for the program and was eligible, we are gonna be able to serve those. So we're still working with the state right now to get that contract finalized, but we're very excited about that. Does anyone have any questions on the dashboards? That was my most exciting news. All right, thank you guys so much.
All right, Jordan, you got our, overview of our policy council survey?
Yes, hi everyone. A couple meetings ago, I gave everyone a community needs assessment questionnaire, and I've received 7 of these back, so if you were not able to respond the last time, I ask that you please complete this for me. What it does is it goes to this data goes into our community needs assessment that will be due at the start of next program year. And this data just helps us shape programs. They can be existing programs, this data can be used for those existing programs, and it can also be used to start new community initiatives. It's really just a way for us to gauge the needs in our community. And we wanted to start this year with our policy council. And this is just these are not yes and no questions, these are narrative questions, because I really wanted to get in your brain about what is needed right now. So I would greatly appreciate that. I also gave you a printout of a summary of what your counterparts have said so far, and I will review this as I get more results in for you. And I am going to just read you a summary of what was found in those 7 surveys that I've so far collected. Childcare, housing, and healthcare access are our major service gaps right now. Our employment challenges include limited higher wage opportunities and family-friendly jobs. So several said that they feel families need jobs that can meet them with their family needs and their childcare needs and that type of schedule. Career and training support is in demand, especially job readiness and soft skills. Many mention the soft skills. Educational barriers, such as cost, access, and emotional struggles continue to impact, our adult workforce. Those individuals who may have exited high school without finishing their, degree. Financial insecurity was noted to be fueled by high housing costs, debt, and a lack of financial literacy resources. One of our policy council members spoke on, those payday loans, those predatory loan places really being something that, sucks in our lower income families. Mental health services and transportation are major access issues, and it was noted over and over again that community engagement is low across our region. So, there's a call for more inclusive, family-oriented activities. Like I said, this was just 7 responses, and so if you've already filled this out for me, you do not need to do that again. We just wanted to start with you all and get you more involved in that process for this next program year. Does anyone have any questions for me?
Well, appreciate you helping fill that out, and if you haven't had the opportunity to do that, we would certainly encourage you to do that. This is the type of thing that leads to so much. I want you to, I don't want you to think, hey, we're just having to fill out a form and we're compiling the data, and that's as far as it goes. We are constantly looking at new programs to develop and to add, and to evaluate, are the ones we have now, are they moving the needle or not? So please keep in mind, this information is used quite a bit to try and determine what we need to be doing in the future and whether or not we're being successful in what we're doing now. So we're just gonna keep going. We'll move over to the overview of the policy council agency budget and physical department overview.
You can skip over me, I don't like talking.
So Jude might be a little upset that I got on the agenda.
Totally the cliche, finance person that doesn't like talking in front of people. It's not something I'm real comfortable with, but, they suggested this might be a good thing to talk about. So what we included in your packet today is just the budget that we present at our bi-monthly, board meeting. We always present it to the executive committee to let them know where we're at financially. And this is actually our budget for our next fiscal year. So just to kind of go over a little bit of like how our agency's funded, you can see at the top where it shows our federal and our state grant funds and what we've projected for next year. The majority of our money comes from these types of grants. And even though it looks like we have a large amount of federal, most of that does flow through our state partners. We do have a couple that are contracted directly with the federal government, like our Head Start. But for the most part, those do flow through the state. And we do also get some contract revenues with our transportation department. That's probably one of the biggest ones. We contract with TeamCare to provide trips to the doctor for those clients. And then we also do get a little bit from our fares when people ride. They pay for that. And then we do have some other sources of revenue from, like, we have programs that generate what we call fee-based services. And so one of those is we do have our Choices program. We provide a service for them with personal care, bathing, things like that, and then we're able to invoice for those services through their health insurance provider. And then we also do have in-kind. So we have some grants that will require match. And that could be in the form of cash, or it can be in the form of in-kind. And so that's one thing that Mark and I really look at whenever we're looking at grant opportunities. Is there a match? How much is that match? And are we able to provide that through cash or in-kind? Obviously, if it's a grant, that's gonna have like 50% match, and it has to be with cash or funds directly. That's something that we really have to look at. So we always say that not every grant is always a good fit for our agency. You have to be able to provide those additional funds to meet those requirements. If you look at the bottom of the expenditures, you will notice that our salaries and our fringe benefits and our administrative costs are about half of what our total expenditures will be. So staffing is always something that is a line item that's gonna be a big part of your budget, because you have to have the people put in place to provide those services. So if we get additional funds or we receive cuts from our partners, usually those are the line items that they will affect first. So that's a big part of what we look at. That's, you know, when we're looking at cost of living raises for staff, like that's something we have to look at every year. Is the funds there? And a lot of times we get grants that the funding is kind of stagnant, and so we don't get increases. So really for us, that's almost like a decrease, because especially since COVID, the labor market kind of exploded, and so, salaries now are at a higher level for starting pay than what they were in the past. The job market got extremely competitive, so that's something that we really had to look at moving forward with our budgets, and, you know, really try to work and try to get those increases where we can, or get additional grants to kind of supplement some of our current, programs that we have. If you look to the right of the page, I've got listed like what we call our program or our matching funds. So how do we generate those funds to match these programs? And so one part of that is we have our state appropriation. So every year the state's gonna give us an allocation, and we can use this to match our programs. And for those programs that sometimes we put caps on, our line items, like our administrative costs. And so that helps us meet those match requirements. We also get dues from our state, or not our state, but our local cities and counties. And so that's something that's based on their population, and we have a per capita amount, and that's how that's calculated. And we also use that to match. And if you look at our non-grant related, expenditures, part of that will be supplies or things that we have that may not be allowable to pay for under a grant. There's very specific things, training requirements that we may have to do in-service things. And then we also just kind of have an other category, which is where sometimes we can't serve clients with their program dollars, but if they're in a crisis or in a need, we can have these funds to tap into, throughout the year. And then we also have interest on our line of credit. So just due to the nature and the size of HRA, specifically like through our light heat program and some of our other social services, you know, we have to provide these services, you know, to an immediate need. And with a lot of our grants, we work on a reimbursement basis. So we have to spend that money before we get that money back. So our line of credit allows us to do that. That interest is not something that's allowable to be charged to our grant. So we kind of have to know that that's something we're gonna have to pay for every year and budget that in. And so when we look at that, we kind of look and see where we fall out for the year. So when we put our budget together, ideally, you know, we want to at least make sure that we have a balanced budget. Now, a lot of years we will have a little bit excess of our revenue from our fee-for-service programs or things like that, and that will go into our fund balance, that if we have a year that maybe we have some unexpected expenses, we can tap into that. But when we're looking at just putting this together, we just try to focus on making sure that that balance is at the end of the year. And that's just kind of a high-level overview.
Tell you what, she's lifted the hood on the vehicle and let you see how the motor works right there. You know, you know, obviously she's highlighted quite a few numbers. We're sitting around almost $3.8 million that's just going directly to clients. So, but keep in mind, a lot of our services, like public transportation, is a huge component of our operation. It's all labor intensive. So, you know, we're providing that service, and that's the value to the client as well. But, you know, from Ginger's perspective, and I give her credit to this, we look at ways that we can always maximize the dollars that we give to our clients, or put into our clients' hands, over what we're gonna spend internally as an agency. So, does anybody have any questions, or any comments on that? Was that a little too deep dive, or, Ginger will be happy not to come back for a year or two.
Every June meeting, what do you guys think?
I think so. Maybe more than you wanna know, but yeah, it's just kind of how we put it together and kind of like where those numbers come from. And
another thing to keep in mind, and we've had some big programs that we've added, obviously the Empower program was huge. You know, you go back, when Ginger and I, we took over roughly 2018, something along that line, we were at that point about $18-19 million a year budget. So we're back up to that almost around 30 million approximately. And there's gonna be dips, we're gonna go through periods of time where that number drops back down, it's just what it is. But that's the game that we always play, we're always trying to replace programs that may be rolling off with new programs that can take their place, and obviously that provides consistency for our employees, but it also makes sure that we're providing an adequate amount of services for our region there, so. No questions? All right, well, I'm gonna move on. You know, I'm gonna go ahead and, I don't wanna say rip the Band-Aid off, but you know, our agencies change, and agencies like this, they change over time. Sometimes it's because we decide it's in the best interest for that to happen. Sometimes it's because the federal government and the state of Tennessee decides that as well. And we've had one of those things occur, I just wanted to put it out there. I'm gonna present this to the board, or the executive board here in a couple of weeks. I will caution you, I spoke to our news media here, we do have still a few employees that are not aware of what I'm gonna say that affects them, so I think they're graciously won't give us to the end of the day to make sure we have the ability to talk with each one of those. But it's sort of one of those hot off the presses. Now, our philosophy too, what's good for our agency? And then more importantly, there's what's good for our clients. What's best for the citizens of this region? And the state has looked at the program that we've administered for a year, and we have numbers and we show them all the time. That's our commodities program. We're systematically, and I don't know, how, does anybody, who back there can tell me how long we've had commodities? Forever?
Carrie said as long as she's been here, there's
Okay.
been commodities.
So, I mean, you're talking about 20+ years?
I was 21, yeah.
Alright, so I mean, we're talking about a program we've run for forever. And you know, I feel like we've run that program successfully over the years. It's one of those, we don't make any money off of it, we actually have to put money towards it to make it work. But the state has looked at that, and I think what their intentions are, and we don't, all we know is we're gonna be out, we don't know, all the full details, but it looks like they're gonna be contracted with Second Harvest, probably in our area, or the majority of our area. I think there are 4 major food banks across the state of Tennessee, as I understand it, which Second Harvest, for the most part, serves our area. They're already doing food distributions in our region, and I think what makes sense to them, and I'm gonna be honest, from a business perspective, I can't argue with it, because I think it does make sense just to contract with the one agency to do all the work. Now, would I love it to be us? Yes, but I'm gonna tell you what, Second Harvest has the ability to do stuff that we can't do. So one of the things they're able to do is to put, more of a variety of food to their families. They're able to provide meat products that we are not equipped to provide, and fresh vegetables. So at the end of the day, it's gonna be different, but I talked with all our county coordinators this morning. You know, our gut is at the end of the day, the citizens of Upper Cumberland are gonna be better served because of this. And you know, it's one of those things, I think us as an agency, we have to realize that, we step back, we say, all right, somebody can do a better job, and we need to swerve in doing that. So, we wanted to put that out there on the table for everybody to sort of know that when you start hearing that the traditional commodities program is going away, it's not because we're ending it, it's because the state has elected to go in that direction. And, I'm sure there's gonna be constituents that is concerning to, and that's another thing. We need you, as that word starts getting out, you know, you can quote me, I think they're gonna be better served. And it's no knock to our employees, no knock to the program that we've administered for years. It's just with changing time and with Second Harvest having capabilities that we don't have, we have to recognize that they're a better choice for us. So we're full support of that move, so. But as those things start getting out there, I mean, Jim's gonna run that in the paper sometime, and Stone Tom's gonna put it on the radio sometime, so we know people's gonna start hearing it, they're gonna start getting concerned. I think the key for us is just simply say, hey, I think it's gonna be a good thing. I think, wait and see, but pretty sure it's gonna be a positive move out there, so. And it looks like, in discussing with them, they have an infrastructure in place to serve all 14 counties.
When will this start?
Our contract ends the end of September, so we will continue on distributing as we have. We do, every 2 months in all of our counties, so I don't know who's slated for September, but whenever we get through with those, that'll be the last 2 that we can, or we believe.
Will they be doing the same frequency, like
I
everything
can't
you don't
answer
know, and will they have the same income qualifications?
Well,
We've heard that might be a lot more lax
Yeah.
than the income with Second Harvest versus what we did. Now, we don't know, all we've received first is the first email correspondence. They're setting up a meeting sometime in June, early July. So by our next meeting, we should have a few more details that we're able to share.
Are they gonna serve our different locations, like Cookville, or, I know there's one in Baxter once a month.
So we,
And
yeah,
it's very, very lax, I mean, people just line up,
yes.
and, you know, how many bags you want, they do the food and the meat and everything.
So I hope that, we get to meet, maybe with Second Harvest and meet with some of them and kind of share how our operations have ran and different things, but I don't know. That's something that I would request if that's something that we can do. But I definitely think after we have this face-to-face meeting with the Department of Agriculture, Grant Pulse is who runs that program, I think we're gonna know a lot more details to make us feel, more comfortable that everybody's still gonna get served and have access to more food and more variety, because that is something that we've heard from the folks receiving commodities throughout the year. You're heavy on the beans, heavy on the corn, we would like more of this, more of that. We didn't really have, we didn't get to choose a lot of that food. So I think with Second Harvest, from what I understand, there's a lot more variety, a lot more choice. So that does make me happy for our folks that utilize that
We
program.
have cooking oil and all kinds of stuff
Yes.
with it, which is, it helps people.
Yeah.
You got a can of beans, but then, if you wanna make hamburger,
Absolutely, 100%,
so you
yeah.
need that kind of stuff.
yes.
Jackson County does that every 2 weeks.
So
So
it
see,
may-
that's a lot
it gets
more-
better coverage.
Every other Thursday.
A lot
Used
more
to do
frequent
it
than our
every
every
Thursday,
other
but
month.
they just don't have enough volunteers. It's a big job.
So maybe that's how, we can also be supportive that, talking with our county coordinators can talk about folks that have volunteered with our commodities program. Maybe they would, start volunteering with the Second Harvest to help get that food out.
I volunteer for both
Thank you.
one, and there'll just be one now.
Just, you're consolidating those volunteer opportunities.
And let me make sure we're on, because we're using the term Second Harvest, and they are big in our area. I think we do have, Van Buren, we were talking about, maybe served out of Chattanooga, so they probably won't cover our entire 14 counties. I would just say, hey, one of the local food banks like the Second Harvest.
Yeah.
Is gonna be taking over, so.
But in Jackson County though, all surrounding counties is welcome to come and get food.
That's wonderful.
I think I missed what you were saying about they're not gonna cover all 14 counties, so what do the counties that aren't being covered?
Well, there's 4 food banks, Second Harvest is just one of those 4.
Okay.
So they're, like Van Buren, I was saying, they may be served out of Chattanooga, which is a whole different agency, not Second Harvest. We don't know yet where each county's gonna be served out of.
But we
I just
will
know
be
the
served.
majority of our communities are getting Second Harvest.
So maybe food banks would be a better terminology just to say instead of specifically Second Harvest.
Any other comments or thoughts on that? I know that affects a lot, if you look at our dashboards, that's probably 300 plus families on a consistent basis, month after month across the region and the different communities, so, that touches a lot of needy families, so. Alright, if nobody else has anything else on that, I'm gonna continue on. The next thing I wanna ask you, before I do a little bragging about one of our programs, I'm gonna go back to that needs assessment. Department of Human Services has put out a grant announcement for community grants. They're sort of broad-based, they're able to touch a lot of social service type needs in our region. We are looking at a couple of those to see some things internally that we, might be interested in. I wanted, first of all, to make sure you're aware of that. If you've got a nonprofit or some group in your community that may be interested in applying for those, certainly would encourage you, we'll try and assist whatsoever. If you have an ideal of something you'd like to see us apply, we're game to that as well. So if you think about the demographic that you're covering, and you've always thought, man, we really need this in our region, or I'd love to try this in our region with this group of individuals or families, get with us, let's see if we can, do something with it. I do believe it's all through TANF funding, so it has to be family-based, it has to have children in the home. It couldn't just be a senior population or a single population, it'd have to address the family unit. So, those grants are out there, and we're, like I said, we're actively looking to see what we can apply for, but are open to other suggestions. So if you've got something you wanna try, let me know, we'll see. If you ain't got the capacity, we'll see if that's something we're interested in tackling as well, so. I wanna brag, we handed out a flyer, and I know we've talked about this program, it's still fairly new. You talk bigger picture, and Michael, you were at our event a couple Fridays ago. We're operating the day reporting center through the Department of Corrections, which works very closely with Michael and his team there, for individuals that, are suffering from addiction issues, they've gotten in trouble in the court system, and, they don't need to necessarily go to jail. They need rehabilitation. They need to get treatment for their addiction, and they need to get rehabilitated, and they need to get back in the workplace. And I wanna brag about that, because we had a great event, back a couple Fridays, or maybe last Friday, that was 2 Fridays ago, I think. My days are running together. We did a graduation. You know, we've been running that program now for a couple of years. I think we had 11 graduates that day out of our program. People who have successfully gone through, they're on the road to recovery, they're making all the steps they need, moving back into the workplace. And you know, I thought we would, going into that was the first event we had like that, and it was over at UCHRA in their conference room over there. I thought, well, we'd have our participants there, and we'd handle their certificate, and it would be a thing. Cindy, it was like graduation. They brought their family, the conference room over there is not quite as big as this room, maybe 2/3. It was full. They had brought their kids, their grandkids, the families. It was a packed house, a great event there. And I just wanted to highlight that because we do see success. You know, there's a lot of people we try and help. Like when you deal with a lot of people, and you can give them all the help in the world, they're not ready for a change. We've been able to successfully work with a group of individuals that were ready for that change, and that was a great graduation ceremony. That leads you to.
As time goes on, you may have found a bigger place to hold them.
You're exactly right, I'm gonna tell you, and it is growing. You know, it's one of those things I love. Of course, we had the sheriff there, we had one of our judges there. One of the graduates, and I won't get into names and stuff like that, but one of the graduates, he really wanted the judge. The judge is the one that he had went before and had sentenced him. Be honest, the judge didn't remember. He didn't remember sentencing him. But that young man was so touched by that and realized what a difference it had made, he had asked for the judge to present him that certificate. And you know, it's one of those things, you know, that shows you a real change, you know. There's not a lot of people who've been in trouble with the court system that really likes their judges. But it shows you that they had seen what an impact that had made. So that was really a very, very successful day, and we're very thrilled about that. Of course, those individuals, they're there because a judge has sentenced them there. They don't have a choice, do they, Michael?
Not much.
No, they're there because they've been made to go there. Our UC Recovery Connect program, I've handed out an initial flyer there. We, had a meeting on this yesterday, and we're about 5 or 6 months since full implementation of this program. This is funded through our opioid abatement money. I'm gonna tell you, our numbers are through the roof. You can see there, just that stair stepping from January to February to March, April to May. We're now actively working with 159 individuals. They're not sentenced there. They did not come through a court system. They had a family member or a coworker or somebody, maybe themselves, got to the point and said, hey, I need help. I need to get where I need to be. So we've got 159 that we're working with there, that's come from a number of different referrals. And not only are they in the program and growing at a fast rate, I mean, you look at that, we had 203 referred, of that we got 159 that took help. That's a 78% acceptance rate, which is phenomenal. Of that, of those 159, we've got 153 that's having, on average, since the beginning, 4.5 follow-up visits, which is another key. It's not just that they entered this program, but you see month after month after month, they're still working the program, which is vital to getting to recovery right there. We're very, very excited about this program and what it's gonna look like in time. Now, these are the first 5 months. Hopefully, 6 months from now, those numbers haven't stagnated or they've not turned in the wrong direction. I'm hoping, as we continue to look at that, these numbers will continue to grow. Now, there'll be a point where we cap out how many people. I mean, we've got 14 CPRSs. They can only help so many people at a time. So there'll be a cap somewhere, but we wanna get to that cap as quick as possible, and we wanna see the success that follows up on this. So
I would say, and of course, like any kind of program you start, you know, the more successful you are, the more it's gonna grow. And I think in this area, you're looking at potentially some major growth. And I don't know, I mean, if you look at statistics on this stuff, I don't know that it's gonna become stagnant at any point. I think it's probably always gonna grow as long as you're successful operating it, it's always gonna grow. This is probably one of the things I've been the most excited about, especially with the CBRS program. I held a district meeting over at Shaw's office and had Melissa come in and really get into details about that program with everybody. And they've been really excited about it since then. I know I think it was the next day, 2 officers were calling on the CPRS, talking to them, and bragging about how great they were to work with and stuff. So this is a really good thing.
they are very passionate, and we're talking about having a cap on how many we get into. It's not, we're not encouraging them to work, we're usually trying to pull back the reins on them, because they are very passionate. A certified peer recovery specialist is somebody that's gone through addiction, come out of it, got their life stable, and they're wanting to give back. So it's somebody that has walked that walk. The issue we have more times than not is they're wanting to help too many people because they know what it's like to be in those shoes, and they're not gonna turn anybody away. And we're trying to help them understand, we don't wanna burn them out, they gotta pace themselves or they'll get burned out. But you know, that's the key, those individuals are the key. I'm 58 years old, I've never had an addiction issue, I can't help that person. They have a lived experience and ability to do that. And on top of that, one of the great things that we have access to now that I've never dreamed that we would ever have contracted with a doctor of psychiatry out of Vanderbilt, and we've got a nurse practitioner that's contracted with us to provide the actual assessment and can make, what's the word I'm looking for? Diagnosis and refer them to whatever treatment center and whatever medication they may need. They have the full ability to handle their needs there. So it is a very unique program. We're very excited about it. We hope it'll continue to grow. There again, with the opioid abatement money, there's funding coming out again, and our question is, what is the next step? And one of the things our staff is really excited about and wants us to explore is to do a duplicate type program, but do it for juveniles. where we work with our schools and start a under 18 CPRS program, where you've got, at that age, you've got kids, hopefully in our high schools, and hopefully not our junior highs, but it may be our junior highs too, that may have come through their own problems and got to the point where they're in that school and they're able to help their fellow students. We've got to put that program together and apply for it, but, that is sort of a goal that we have, one of the avenues we're looking at there. There again, my ask to you, everyone in this room, you know somebody or a family member of somebody that's going through addiction right now. This is one of those programs, and I don't think we've got we don't have the phone number on here, but you've got our office number, you can get to our office number. This doesn't have to go through the court system. A judge does not have to send them to this. If you got somebody that has a child, a brother, a sister, could be a parent, that's dealing with addiction issues and they don't know where to turn, send them to us. We've got that team, that CPRS can reach out, they can make contact, that the person struggling may not be ready, and that happens. But you never know, because somebody that can get them enrolled in treatment reaches out and tries to make that happen. So, let people know that if you know somebody that's having addiction issues, they've got someplace to turn. That's, our goal of this program is for the mamas and the daddies and grandmas and grandpas to have someplace to turn. And then not get to the point, Michael, I hope they never get to that court system. We don't want to ever have to stand before a judge. We want to try and get them help before they get to that. So, that's, any questions or comments on that?
Mark, I just had a comment on that. Excuse me, I think the fact that you want to reach out to the school systems is wonderful, because we see more and more kids turning to vaping, and we see more of the harm of vaping and the accessibility of it and everything. But I would also encourage you all to look at a different kind of family transitional counseling. When the person does become clean, that person's life is changed in a completely different way. And if the family has only known that person a certain way, how do you let that new person, that new and clean person, step back in? And I think that's really, really important for the children and for the parents, if there's a spouse, for the parents of the family. I think that would be just a really great piece of this. And hopefully it could look different. It might not look like the programs that all the other agencies have done in the past.
Yeah.
So, I've worked with a few different groups like this, but the one, when you said the juveniles, what has been on my heart lately, kind of a burden, is the juvenile detention centers, and wondering because I don't think I've ever heard of programs or resources, or, I know there are positions and people that work with the juvenile justice system, but how much of that, and if we're looking at prevention, I really feel like we need to put more focus there.
Yeah, we actually brought that up to Sheriff Ferris, because they administer the juvenile detention here in Putnam County for pretty much all of, I think, the surrounding counties. What he told us is they rarely stay more than a day in juvenile detention. So if they're getting released, and the point he's making is there's not really a structure to take care of them afterwards. So that is an area, I'd love your 2 cents on that. That's one of those we're looking at, trying to see what it would look like. It's something we're making from scratch. So unless somebody has a model we can look at, we just need to figure out what we're doing wrong.
If nothing else, it might be good just to have a CPRS to go meet with them before they're released, to see if they have any needs.
And in the school system.
Good start.
Yeah.
And in the school system, I noticed, and to be transparent, my child behaved or acted out in school. But I looked at records and I noticed like terminology, and they class them as offender in the reports, like in their behavioral reports. And I feel like we're almost setting them up to see themselves that way by using. I think we need to look into more ways we're approaching the youth.
Stigma is a huge.
Is it the 10-year-old is listed as an offender? you're kinda growing up thinking that mind mentality already.
Treat them like a criminal from early age there.
Right.
Words?
Yeah.
to wrap around services too, when a person comes out of addiction or needs, you know, like Boys and Girls Club. I remember Jamestown had that, and we met with some people, but just didn't kick it off here in Putnam. I remember people in Monterey were interested. Didn't Crossville used to have a facility for prevention of drug? Cause I have a dental hygiene background, and I was with Department of Health with 10 Care Grant, so I'd actually speak in the summers at, it was near the old elementary school, and it was specifically for drug prevention, but they would have some nutritional classes, and then I would speak on smoking and things like that. Of course, vaping is huge now, but, and I worked at Health Connect at night prior to coming to the position that I'm in now. And I know that we would do with Chance, you know, we would still use the adult Hazelton program. So we really need things that are curtailed to juveniles, mental health, but prevention, but also when they come out successful, how to wrap around them and help them continue on.
And DeKalb has the SPOT youth program, well, Smith County has the SPOT, DeKalb has one similar to that.
I don't know if DeKalb still has it, but I know that years ago, they used to have the DeKalb, Drug Prevention Coalition.
Yeah.
And it was really neat because there were meetings with different agencies. One of them included a counseling center. And I know that they were doing really well for a while. And also trying to kind of get on the back end of like, okay, what, is this somebody that keeps coming back to this and why? Because I think getting to the root causes of it would be a really important thing so that we can start prevention. A lot of it, I know specifically for DeKalb County, one of the things that we had tried to do is to set up more events and stuff because there weren't a whole lot of things for teens to do that were actually constructive if they had no other guidance and their living environment wasn't optimal.
We do have the best groups, best programs in the schools, and that's really helpful.
What is that called?
It's a,
Best group.
Best groups.
with the, oh, I know, Heart of the Cumberland, is that who?
Okay.
BEST Group stands for Be Each Other's Support Team, and it's a faith-neutral program for kids in 2nd through 8th grade that have experienced loss due to the death of a parent, due to adoption, being in foster care, deployment, deportation, divorce, any being in a home where there's unresolved mental illness or substance abuse. And last year we serviced over 500 kids in that program. It's an 11-week training that they go through, and it's really very peer supportive. It's where the kids really get to communicate. But we just got the statistics back the other day from that, and I thought the most interesting thing about it was we do see a lot of children whose parents are incarcerated, but we also see a lot of children, and it was like the second thing down on our survey list in numbers, whose parents have a drug or alcohol problem. So I think if the drug and alcohol programs could really address the entire family, because I know that person got clean, but what are the ramifications that it's had on the family during that journey before that person was clean?
And like, what I did before was try to do a parenting course that was more recovery parenting from a recovery perspective, because there's a lot of factors that go into parenting. It's different with parents who are in recovery versus those that aren't.
Do you utilize the AA and NA program in the communities?
We have people on all kinds of
Different pathways.
you know, in looking at juveniles and having a CPRS program and stuff too, I mean, you've got the avenue of, like you mentioned earlier, the DRC graduation, you got all these people graduating who children, grandchildren were there. You know, that's a avenue to get to them is through the parent who's struggling with addiction.
Yeah.
Because most of them will tell you, no, I don't want my children doing this. This should stop with me. And that's a good avenue to reach out to them. Same thing, even with our agency, where we only deal with adults, but, you know, we're in homes with people with addiction problems and see children and see what they're going through, you know. that would be another avenue of getting that out there, you know, once y'all got that put together, we could get, you know, maybe just a pamphlet or something to, that for our officers to hand out to families to maybe spark some interest.
All great ideas. I just need you to keep those great ideas coming. You don't have to wait till you're here. If you've got an idea, Misty, you're good at that. I get all kinds of emails from Misty, it's like, have you ever thought about doing this? Yeah.
Make it up, make it up.
Any other thoughts or comments on that? Any other programs you'd like to see us explore? Any burning issues out there that you don't see anybody trying to tackle?
Is there a regulation on, children doing that, baby? Is there a regulation on?
Age?
They're not-
Yep,
So
yeah.
the
Like
age
buying it and stuff, I don't know, I'm just.
I heard it was 18.
It is.
Yep, yeah.
The problem is though, it's so accessible, you can order online, anything online, so you don't have to actually go to somebody.
I can tell a story about a family member's friend. It's in another state. His friend, they're 17-year-old, and they've been vaping since they're 14. And one of them has a lung obstruction now. He cannot breathe without his own medication. And the other kid is my great-nephew, I guess. It has mentally destroyed him. And come to find out, they've been vaping since 14, since they were 14.
I think, I don't know, this is just things that I've heard, but I think it's really important for any facilitator at any capacity, to actually walk the talk. And this is just for me, like, we had, you know, sports events and others, and you hear the kids talk or the parents. But I have heard repeatedly that, you know, they will hear presenters come and talk to them about how awful vaping is, or doing drugs, or things like that. And they observe the person who just went and talked to them. After they talk to them, they see them outside, and they're doing exactly what they told them not to do. So that's a really awful message that's being sent, in that regard.
Do as I say, not as I do.
You'd asked about, and I'm an idealist, so, and it's just a big process, but I work with aging individuals in long-term care facilities, so I see the end of life, and I see drug addiction. But I think we are really cutting the ties of the continuum of the family, you know? People are not getting bullied, you know, and I just see the lights go on when the grandkids are able to come to see the people in the summertime that we're seeing right now, or the staff member might have to bring in their children, and the long-term care residents just absolutely love it because there's life and vitality in there. And so a thing that in my mind, of course I'm an idealist, is healthy me, healthy we, aging well in Tennessee. And it's just to, and I don't know, it's you know, have to be a lot of platforms, YouTubes or shorts or things where you can reach kids, but just the continuum of mental health, physical wellness, social wellness, but we need to tap into the wisdom of our aged. And also, I can learn from, you know, a teenager, I can learn from a child, but we need to keep families together and tight and healthy.
All right. Is that your own quote you come up with?
That,
Say
you know,
again.
that is something I brought to Marie one time. Healthy me, healthy we, aging well in Tennessee. Now, healthy me and healthy we, I just came up with, like, cause I'm kind of a social worker, I have a master's in public health. I love education, you know, wellness education, but just healthy me and healthy we was actually a pre-K small grant program out of North Carolina, cause that just came to mind, cause it's, you know, it's something you can remember. But if we add, and it's no longer in existence, I think it was out Chapel Hill, but you know, if we can add the Tennessee, we're not infringing on something else, but just the continuum of care. I hope that happens in our community and broader.
I need to apologize. I should have done this when we started the meeting, but I failed to do so. We have two new, Tracy, this is your first meeting.
Yes.
I know, Alondra, this is your first meeting, so Tracy is representing the senior population. You remember we lost Marie Ferrand, unfortunately, back, I guess, around Christmas time, February. So Tracy is filling that position. Tracy worked with Marie for a long time, and, certainly was agreeable to step in and try and fill her shoes in a number of different ways, and one of those being serving on our board. We appreciate that. And Alejandra is taking Marvin Lust's place, who passed away back before, and sometime in the fall there as well. So appreciate both of you ladies coming in. Now, Alejandra, she used to work for UCHRA, that's where I first met her, so she's got a huge background in social service, and both of them do. And Craig, you was talking about your background, you've both been actively involved, and we're very fortunate to have both of you involved with us, so, thank you. With that, I'm gonna go turn it, any new business, old business, anything else anybody wants to talk about? Do we have any public comment? Hearing none, I appreciate it. We're down a little bit on attendance, with summer months, I know a lot of people are traveling, I appreciate you coming and being with us today. Nothing else, take a motion to adjourn. Okay, got a motion, thank you.